was in middle school, I coughed a lot due to the air pollution. But of course, as a teenager, there's nothing I can do. But afterwards, I moved to Canada. I studied health sciences, and I really fall in love with biostatistics and epidemiology. And now I can have access to all the data set from BC Cancer to study the link between air pollution and lung cancer, which was a huge opportunity for me. So this project is actually a collective effort from people who have mathematics background or chemistry background, and also people like me, epidemiologist. So this project is a sub-analysis of a project that have been published several years ago. Our team went back to ask patients about we went back to identify patients' EGFR and ALK mutations. And then I reanalyzed the data set to determine the link between exposure to PM2.5 and lung cancer and EGFR mutation in lung cancer patients who have never smoked. The majority of our sample are female patients, since most male patients who smoked, right? The average age of the average age was about 66 years old. And since it's data set from Vancouver, the percentage of Asian race ethnicity is high, but in the EGFR positive mutation group, it's even higher. We compared the effect of short-term and long-term exposure to PM2.5 with EGFR mutation in lung cancer patients who have never smoked. And we found out there is significant association between short-term exposure, which is 3-year cumulative exposure to PM2.5 prior to diagnosis in the crude model. However, in the adjusted model, the association was not significant, but it indicates a link. For our next step, we would like to expand our study sample, recruit more participants, and if we can recruit participants from other geographical regions, would be even better. And also we want to add more covariates, such as different air pollution indicators. And also we want to improve how we measure exposure. Implication of why the short-term exposure is associated with the EGFR mutation. The implication could be this can, of course, this is very preliminary result, and we want to verify it with a larger sample size. But it seems like the risk of EGFR mutation in lung cancer patient is associated with short-term air pollution. So that means it's possible that we can add this specific indicator or predictor to a predictive model for lung cancer risk. Potential association between short-term exposure and EGFR positive mutation in lung cancer patients who have never smoked may suggest that air pollution itself is a promoter. It promotes lung cancer or facilitates the development of lung cancer.